Welcome to the TRT and Hormone Optimization YouTube channel. And as a guest today, we have Dr. Adam Hotchkiss with us. Welcome, Adam.
Hey, thanks, Dr. Davos. I'm happy to be here. It's crazy hearing that intro. I've listened to you for so long. It's just like watching YouTube.
It is. So tell me, Adam, maybe introduce yourself shortly because I'm curious too. How do you come from being a foot and ankle surgeon towards specialized into HRT or TRT?
Yeah, for sure. So it's kind of a long story, but I'll try to summarize it here. Essentially, I got into medicine wanting to work with athletes and in fitness and work with people that were like-minded because I was an athlete myself, and I quickly realized that in the field that I picked, which was foot and ankle surgery, as you mentioned, I wasn't really working with as much injury or trauma as I thought that I would. Maybe that was 5% of my practice, but 95% of it was in diabetic wound care and limb salvage. So preventing feet from being cut off or legs from being cut off, due mainly to preventable disease. And so I found that I was working with the exact opposite population that I wanted to be. And I started getting more and more towards health coaching. I was, like I said, an athlete myself, and I was also an athlete who used and abused at points and researched a lot of anabolics and various compounds like that. So as my own personal journey took me more towards longevity and away from the anabolics, I started to coach other guys too on how they could do these things healthier, or how we could also just work with your everyday guy and get them to prevent these diseases like diabetes and hyperlipidemia and all of the cardiovascular diseases and things that we see. It was basically a long evolution of just being unhappy in the medical field and being in that reactive type medicine and wanting to do a lot more of the preventative side of things.
Mm-hmm. Yeah, I understand. So today we were going to cover some different topics. So let's start with prolactin. So high prolactin in men, it's very searched topic on YouTube. So what are the causes, the symptoms, and maybe also the treatments?
Yeah, prolactin is a big one. And I think it's something that people don't look at enough. I've talked about my own experiences with prolactin on another podcast where, like I said, I've been on TRT for years, and I know that my testosterone is dialed in because I have an exogenous source of it, and there's never going to be a low testosterone. But there was a point when suddenly I felt like I had very low testosterone. I have a beautiful wife, and I had no libido, and I couldn't understand it. I really just didn't want sex. My erection quality wasn't as good. It was taking me a long time to achieve orgasm, and all of these things that I would think are testosterone. And so I went and drew some labs, and my prolactin was high. And I think it's important to first kind of think about what prolactin does, especially in men. So prolactin, has that word lactin there, means milk. In women, it helps them to produce milk for breastfeeding. So pregnancy, they start producing milk, and then when the baby is there, things like suckling and things produce prolactin as well, and they produce milk. Men, obviously, that doesn't happen. In men, one of the main things that prolactin does is reduce our arousal after sex. So that's when we have kind of the highest levels. So sex is, there's a lot of dopamine produced during sex. And then immediately after, when we orgasm, I think every man knows that feeling where suddenly your arousal is just gone. You kind of just want to roll over and you feel like, you're not interested at all. And that's pretty much mediated through prolactin. So we can imagine that if we have high levels of prolactin chronically, we kind of feel all those same symptoms, just like low testosterone. We have low libido, we have low motivation because, again, it's acting against dopamine, that motivating hormone. We have poor erection quality. We can have a hard time achieving orgasm. So our refractory period can be inhibited. So, that means we have one orgasm, may not be able to have another for a day or so. So when we realize that a lot of the symptoms are directly associated or similar to testosterone, we know it's a big hormone to be looking at. There's a lot of different things that cause elevated prolactin. As we just talked about, there's sex. So I kind of look at physiological and then pathological reasons. So physiological, sex, exercise, these type of things can increase prolactin, or breastfeeding in women, or as a man and as a father, even being around a child who is crying can actually stimulate a little bit of prolactin. So it's not uncommon that I see new fathers come in and their prolactin levels are a little bit higher. So that's happened. But pathophysiologic, we have a lot of different things that can cause it. Estrogen is a big driver of prolactin. And so back to my story, mine was elevated because my estrogen was high, because I was being lazy and I was skipping my injections and doing boluses, maybe one injection a week, which caused a elevated free testosterone, a lot of aromatization. My estrogen was higher than I should have had it. And estrogen can really stimulate prolactin in two ways. One, it directly stimulates the lactotropes of the pituitary to produce prolactin, but it can also work up in the hypothalamus and suppress dopamine. Now, dopamine is an inhibitor of prolactin. Another name for dopamine is prolactin inhibiting hormone. So estrogen is definitely a big one. Another really big one would be thyroid. And this is another thing that not enough guys look into, is their thyroid function. So thyroid production kind of starts in the hypothalamus when we produce something called thyrotropin releasing hormone, or TRH, which then stimulates the release of thyroid stimulating hormone. That TRH will stimulate prolactin production as well. So it's not uncommon, or actually it's pretty regular, that a guy with hypothyroid or high levels of TRH and TSH will have elevated prolactin. And then they're having all of the side effects of low testosterone again, but maybe it's just coming from the actual thyroid issue and not the testosterone. And then some other things, there's a lot of drugs that will cause a reduction in, or an increase rather, in prolactin. The ones that we see probably the most are SSRIs. It kind of crazy. I see often guys actually have low testosterone. They go to their doctor and they tell them, "Doc, I've lost my vigor for life. My libido's down. I can't make it through the day without falling asleep." And they immediately get put on an SSRI. And then the SSRI stimulates prolactin. They already have low testosterone. Prolactin lowers their testosterone even more. And it's this terrible downward spiral due to an SSRI. So that's a big one. In this athletic community, another one we see often is kratom. Actually, kratom will stimulate prolactin, since it is similar to an opioid, which also elevates prolactin. Cannabis, or THC specifically, will increase prolactin. I've heard, but I've never looked at the research, that eating cannabis or THC has less of an effect on prolactin than the smoking does. So that's something of note. But there's other things. I think verapamil, which is a blood pressure medication, can increase it. There's some antihistamines, like things that you would take for ulcers and things of your gut, that can cause it. So there's a lot of different causes of the prolactin.
Mm-hmm. And so concerning treatment, of course, it's always tackling the cause, I guess. And what if people can't find a cause and prolactin stays high? Is there a primary form of hyperprolactinemia?
Yeah, so there's usually D2 receptor agonists like cabergoline or bromocriptine are them, but due to the negative effects of those, for example, like caber has some issues with hearts. It can cause valvular issues. Bromocriptine, I don't believe it has that, but there's other issues with suppressing prolactin too much, and that you just kind of let dopamine go unopposed. And it's not uncommon to see guys start partaking in risky behavior. They start gambling too much, driving without a seatbelt, things like that, because their prolactin is so suppressed and their motivation hormones are just running wild. So we personally like to start with P5P, which is the active form of vitamin B6. It has been shown to have a suppressive effect on prolactin. But like you said, getting to the root cause is usually a really important thing. And it's normally, I see where I see it the most is either estrogen, because their estrogen is too high, again, due to poor dosing protocols more than anything, or thyroid. And thyroid's a really big one.
Yeah. Okay. Thanks for explaining. Check out my TRT workout split or the ebook The Ultimate Guide to TRT Cream. Links to the merchandise shop in the description.